small pool play over here. What we're going to do is a very short exercise session for 2 minutes.
Yeah, so if everyone has been sitting for the last 20, 30 minutes, if you can stand up. Now, some of the chairs are not facing straight forwards. If you want to turn your chairs around, I don't want anyone getting a sore back or anything like that. You can turn around, face this way, and just roll the shoulders out. Just make sure you're not getting any aches and pains from sitting. Has anyone ever been sitting in the cinema for too long? Now, if there's anyone who can't stand up, a wee moving, punching of the arms. Just a wee punching of the arms. Good. Good. Just a wee bending of the knees. Good. Good. Just a wee stretch side to side. Make sure you're all quite comfortable, not getting any aches and pains being sat in a chair for too long. Okay, now, if you want to turn your chairs, make them more comfortable so that they're facing the front, please do so. If you haven't got a chair and you desperately want one, speak to someone who is younger than you and tell them to stand up. Hopefully you're all facing straight forwards, and Dr. Adrian Baker is going to take the next session. Okay, so make sure your chairs are all facing straight forwards so that you're not going to hurt your back. So just take your time, turn some chairs around so that they're not facing the wrong way. Good, good, good. And I'll pass you over to Dr. Baker.
Thank you very much. Thank you very much. You can all hear me, I hope. Absolutely fantastic to see so many people here, and thank you very much to David for his introduction, John for doing an excellent one there, and our exercise classes, which we'll all benefit from because you're going to have another session shortly as well. David's quite right, we do a lot of innovation here. We're looking particularly, we've got doctors in training with us, so we've got medical students who also take doctors in training who are working their way up to becoming fully fledged GPs as well. And usually as well, we offer a very integrated service here. And quite a lot of you will have come across us over many, many years. And since 2004, we've continued to run our community hospital here. We run our integrated out-of-hours service here. We've got the minor injury unit, and we're here for you 24 hours a day, 7 days a week. So I think that's quite a unique and position to be in, particularly for GP practices. And moving on with other innovative things. About 3 or 4 years ago, we ran ALICE projects. We integrated where we collated all of the third sector organisations in Nairnshire. We came across there's an awful lot of you here today, but there's actually over 120 voluntary and third sector organisations within this area. So we were stunned by how active and busy and well organised Nairn and obviously are as well. Moving on at the moment, other innovative things we've done is to run 65 and 75-year-old checks, so you can come in and get your a wee health check, and also look at anticipatory care planning for you, legal health. All of these sort of things are really important things to look ahead. And we've also got the Citizens Advice, who run a sort of open access service on site at the health centre as well. So we've worked very closely with the Scottish Government, and we have worked on IT projects with them over the years, and this has grown out of a conversation that we had coming up for about 2 years ago now. So these things do take time to evolve, but 2 years ago we started discussing things with NHS 24 around self-care and help them. Little one, as long as you can start playing with the computer, we're all right. So we started working on self-care projects, and as part of this particular website I'm going to show you today is another way. It's not instead of, it's not a substitute for, but it's another way of accessing healthcare. A lot of you are very computer literate, online, happy to book holidays, happy to book flights, happy to do a lot of online services, and my parents are 86 and 79, and it's very rare you see them off the iPad or their mobile phones. Okay, so they're perfectly happy to sort themselves out. From our point of view as well, there's an awful lot of really, really good information on here that's been validated and run, and the Scottish Government have given this to 11 practices in Scotland for 3 years to run it and see what everyone thinks of it. It's come from a very, very large mega practice in London. All of the information, we'll go through it shortly, but all the information has been validated, the care pathways have been organised very carefully indeed, and we'll just have a quick look at a few ways of going through eConsultation and getting information for yourselves. So a lot of people will go on Google and click in their condition and then come along to us terrified. Absolutely terrified. I've been to Dr. Google. What do you think of this? I've got myelodysplasia here. Yeah, haven't. It's probably a cold. We'll have a look at you. Let's do something else. Do some basic stuff. So instead of going on to Google, this provides you a safe place to get a reliable and valid information for your. That's right. For your symptoms. Okay. So we'll just start clicking through a bit. So this is our website page, this is the front page of it, and we've got this is what it looks like. So all of our bits and pieces are on here, we've got headlines across the top, and you just click on to first page, click on again, and this is what you're presented if you go onto the sort of self-help information system, okay? So if you have a look at, if there's something that's bothering you, and we've chosen back pain in this case, so if there's something that's bothering you, then you can go and click onto that and have a look. And there's 4 options given to you for each one of these presentations. So the self-help information there, there's what you can get from your local pharmacy. I know the pharmacists have done a number of talks on what's available with self-help themselves. You want to speak to effectively NHS 24, and then I want advice from my GP, and we'll come to the GP one at the end. So the self-help bit goes into, it's basically pages of what are the causes of the symptoms that you've got, or condition that you've got, the symptoms, what is normal, or what's self-limiting, and what you need to contact the doctor for, and then what may have caused it, the diagnosis, and what it does do is, on the left-hand side there, on the left-hand side there, you'll see another arrow which points to a link which will take you into the back pain questionnaire, effectively. It's quite a long questionnaire, but it gets into quite a lot of detail around what's normal, what's not normal, what's an emergency, what isn't. Okay? And then various, do I need to see my doctor? This is what you need to do. Various self-management advice, you can print stuff off your computer there. And then learn a bit more about treatment options, and then on to how to look after yourself, how to prevent yourself from getting another episode of back pain. Okay? And if you click on the get advice and treatment from your GP, there's a series of questions. It takes a wee while to get through, but a series of questions that are yes, no, or tell us a bit more about it. Questions on there, and what happens after that is I'll just let you have a quick look at these. So this is our this is our dissatisfied patients so far. There's very small numbers, but when you go through, it's quite a long series of questions, And then that is then, once you click on it, that comes to us at the practice. The next part of the process is it arrives on our urgent screen, and we will telephone you back within 1 working day. Okay, so we get a printout of your symptoms at the practice that you've filled out in your own time, comfort of your own home, and then we'll telephone you back and have a chat through what your problem is and how we can best help you. Okay, so it's another option as opposed to making an appointment or telephoning the practice. So you can sit at home, do this, and within 24 hours or 1 working day, then we will get back to you and go through all of the issues that you've highlighted on there. So this is a very, very early snapshot of a few people who've got as far as that and tried it. The positive comments on the last slide, and obviously I particularly like the last one because we're often slightly prejudiced that older people aren't quite as good on IT, and that comment really got a few smiles and a few laughs there. It's a really nice way of doing it. If you're used to doing things online, shopping, holidays, and what have you, then this is really very straightforward indeed. I hope that's helpful, and we'll certainly be very happy indeed to take any questions from anyone at all. Don't all rush.
Since the whole body is connected, if you were going to give symptoms, would you be stuck to one thing, or would you sort of link in other things that you thought were connected?
Yeah, I mean, this is designed to deal with one symptom at a time. There's about over 100 conditions on that initial presentation sheet. So start off with one, please, and that's really helpful for us. You know, if you've got 10, then it might take you a wee while, but we will obviously get back to you. Yeah. It's the duty doctor who will deal with that. So we'll have a duty doctor or an unscheduled care team that will get that printout of what you filled in, and then we'll go through that with you and work out the best way to deal with your problem. Yeah.
Without seeing the patient at all?
Without seeing the patient.
Observation of the person.
Yep.
It's a big part of the GPs.
It is, absolutely. Absolutely. So if you need to be seen, then first of all we'll read through your symptoms, have a conversation with you on the phone, and then we will see you usually that day.
People don't always report accurately, do they?
No, they don't, but this is it's quite a good series of questions asking you about symptoms that, for example, for back pain, if the back pain had come on quite quickly within a few hours, and you're having trouble passing urine or using your bowels, then we would need to see you immediately. And that would be that you would be directed to contact us immediately. You wouldn't get any further in the questionnaire. So there are red flags, which is that type of thing. So the red flag things to say, for goodness sake, just pick up the phone.
It's the less obvious that trouble me.
Mm-hmm. Well, it's an art as well as a science, and the less obvious it can take us a little longer.
Left out in favour of the science.
I think that there's an obvious place for both, and we will see people. Absolutely. We're not saying we're not seeing anybody. This is an alternative way of, or another option to be able to access the surgery. That's all.
How much contact will there be with GPs in the next week while, given that there's telephone consultation, now computer consultation, when will there be access to GPs?
I think David made a very good point at the beginning. We are absolutely in the middle of a GP crisis in Scotland and in the UK. Funnily enough, there's very, very few people want to be GPs. And that starts off in the medical school. Nicola Sturgeon has announced £500 million more for general practice, and that hopefully will reverse this problem, but it will take another 5 or 10 years for more GPs to come through. At Dundee, medical students who are training with us at the moment will take another 7 or 8 years before they're able to fly solo as a general practitioner. So it's a long...
7 or 8 years?
Yeah, absolutely, yeah. So after you qualify, the additional training to be a GP is another 5 years, and then it takes another 2 or 3 years to get quite good at your job. Okay, so it's the most complicated job in medicine. You're dealing with exactly what you've just described, undifferentiated presentations of people who've got lots of things, more than one symptom coming into your room, and you have a limited amount of time to try and work out what is going on, and that could be social problem, could be psychological problem, could be physical health problem, could be all three. So it's the most complicated thing to try and distill what you can deal with, what you need to do, and then take it forward. And I recognise a lot of people here that I've looked after over many years, and we try our very, very best with very limited resources to provide that continuity of care and holistic care and 24-hour care. We do try, but it's tight. Yeah. I'm very pleased to hear it. I'll pass on your compliments, so thank you. Thank you very much.
Okay,